You are listening to the Fascia Guide. My name is Axel Bohlin, and I'm here with Dr. Thomas Levy and Per Johansson. We're here to discuss your work, Thomas, and your upcoming participation in the Swedish Fascia Convention. First of all, welcome. Nice to have you here.
Happy to be here, sir.
So, when we contacted you about this convention, why did you say yes?
Well, that's interesting. I'll be honest and say, although I know technically what fascia is, I still really had no idea what a conference with the over theme of fascia was all about. But having said that, and having communicated with you as to, well, are you aware of who I am and what I've done and what I've written? And you said yes, and I like your work. At this stage of my life, I'm now 74. I've spent 30 years basically evolving and refining what I consider to be the most important information with regard to understanding disease and treating it. And so, as long as I'm healthy and capable of doing it, I really look to take whatever opportunity that I have to disseminate this information and hopefully have it catch on for later generations.
And for those who haven't read your multiple books or multiple articles, gone through your lectures that you're actually going to find online as well, what is your main focus area and what are your main insights that you've been having the last years?
Well, in a nutshell, the whole idea is that oxidation, which is the loss of electrons from biomolecules. So a biomolecule can be in an oxidized state, loss of electrons, or reduced state without electrons. When it loses the electrons, it loses its function. So your biomolecule doesn't work anymore. So with that being said, it turns out, and I'll make the case, that all disease is not caused by oxidation, it is the oxidation itself. Okay, there's no further abnormal condition inside a sick cell other than the array of biomolecules that are oxidized, their distribution, their location, their concentration. And then that then brings up the next major question or major point is if that's all disease is, and that's all it is, I maintain, then the question has to be is what causes the oxidation? And as it turns out, all oxidizing agents, 100% of them, are toxins. So this then brings you to the conclusion toxins cause all disease because the only way a toxin has a toxic effect is by oxidizing biomolecules. If it doesn't oxidize biomolecules, it's not toxic and doesn't fall into this category. And then that blossoms the whole thing, which is very early on, 30 years ago, working with Dr. Hal Huggins, I realized without understanding all the biochemistry that so much disease came from infected teeth, infected gums, amalgam, mercury amalgam fillings, etc., which were called means pathogens, infections. I later on learned out that all pathogens and infections are problematic because they're sources of toxins. So it all wrapped in, okay? So your primary problem or primarily aim for getting healthy is to do really two basic things: identify and eliminate or attenuate all toxins, and chelate and bring out all the toxins that you've accumulated. And of course, the other side of the coin is bring in as much nutrition and as much positive antioxidants, which are electron donors, to come in and repair. I don't think we realize this, but even in chronic diseases that are advanced, if you can identify and stop the new toxin exposures that you're coming into on a daily basis, having a vigorous supplementation and nutrition program can not only halt the disease process, it can actually reverse many disease processes and diseases that we consider to be incurable and really unimprovable.
So basically, these toxins and this oxidation is causing a body-wide stress that's reducing the functionality of the body. And
Correct.
to make that work again, you need to support the healing capacity of the body, the immune system of the body, by adding things that will reduce the oxidation, basically.
As my mentor, Dr. Huggins, who was a biological dentist, I consider to be the first biological dentist really in the world, told me a long time ago when I was sort of grappling with this. And I was asking, how come if we give a lot of antioxidants, things don't just get better all the time, 100%? And he sort of looked at me a little bit impatient. I mean, I worshiped the man. He was wonderful. And he said, Tom, you don't understand. I said, what's that, Dr. Huggins? He says, you can't dry off while you're still in the shower. And so that was the whole thing was, it's not enough just to dry off. In other words, undo the damage that was done by the toxins. You have to go in, turn off the faucet, turn off the shower, and stop the new toxins from coming in. And so, so basically, you have prevention of new toxins, repair from old toxins. It's very simplistic, but it's very true. Now, achieving a clinical positive result is not as easy as defining what it takes to do it.
I have a question. Which toxins have you found, or would you say, are most prevalent as to when it comes to causing disease?
Far, far, far and away, greater than 95% are chronic dental infections, specifically root canal treated teeth. Now, 100% of root canal treated teeth are infected. Don't let any root canal worshiping dentist try to convince you otherwise. We have the data, we've done the work, looked at over 5,000 different teeth that were extracted. They are 100% infected. Doesn't matter whether they hurt or don't hurt. Now, and we have the data to show how strongly they correlate. I say cause and effect, but you can't get literature to say anything to correlate with root canals in every disease known to man. The primary reason of all heart attacks are root canals and other infected teeth, because we identify inside the coronary arteries the same pathogens that we find in the mouth. Same thing with breast cancer. All breast cancers come from the pathogens in the mouth being drained into the lymphatics and tending to accumulate in the larger breast. But if you had a perfect, pristine mouth, you're healthy. I mean, now, having said that, there are other sources of toxins that are very bad, but they don't have the statistical prevalence of that of the mouth. And those are now in two main categories. The one category is heavy metals. As it turns out, and I put the information in the book in my lectures, is that, well, one of the best examples is the mercury amalgam filling. So we're getting back to the mouth, but it turns out the people that have these mercury amalgam fillings, they accumulate enormous amounts of mercury inside their heart. In a study on heart patients being evaluated for heart transplant that had big, enlarged congestive hearts, biopsies showed it had 22,000 fold. That's 2,200,000% more mercury inside those cells than in normal heart cells. So now, not everybody has that much, but I can tell you, if anybody has that much, we all have a lot. And so it all makes us a predisposing factor to make new toxins worse. Now, that's where we come into the third big toxin, which is the persistent spike protein. Now, since we've had COVID, since we've had the vaccinations, we now have a brand new pandemic of millions upon millions of people with chronic spike protein, a highly toxic substance, unfortunately capable of replicating itself, that not only is very toxic by itself, but we've always said, or it's been said, that it seems that the spike protein targets the heart. Not really. If you look at the literature, the spike protein goes everywhere in the body, but what did I just say? The heart, because of its extremely high metabolic activity, selectively accumulates toxins better than any other organ in the body. So it's already been supersaturated with toxins and is at an elevated level of oxidative stress And then when the spike protein comes along, that's why we seem to have this inordinate number of heart attacks, heart failures, but usually sudden death due to arrhythmia and ventricular fibrillation.
It's interesting because we've talked a lot about when you're talking about fascia in the living body, because fascia is around every cell in all of your body, and it's the fluid flow around all cells as well, which means that it's affected by everything. And what we have made a lot of discussions, I had a lot of discussions about, is that there is no disconnect between your thoughts and feelings and your physical body. So if you're stressed about something, could be traffic, could be a podcast, could be a lecture, or anything, then you will have a physical reaction, which means that there is no difference between thoughts and feelings and your actual body. What most people don't think about is that stress is one thing. I'm feeling stressed, but the oxidative stress in your body is also a type of stress that has the same reactions inside of the body. And we had this episode about epigenetics, and there is a nerve ending that specifies in collecting cortisol. So when the body releases cortisol for stress, the nerve ending catches it and tells the body to stop the production. But if you have a constant stress, then that gene will turn off, or the nerve endings will falter, which means that the collagen production never stops, which means that you have a constant stress. And it's very interesting because if you have a toxin that you're describing that the body can't get rid of, that could also be a constant stress internally, right? And what's interesting with cortisol, for example, is that it breaks down the collagen fibers of the tissue, which means that you are more you don't react as well to any type of pressure. It could be a fall, it could be a movement, it could be a constant bad posture, or any kind of pressure really that affects you. You have a worse your capability of dealing with it is worse if you have that constant stress inside of your body, which is interesting when you talk about the increased level of toxins and the spike proteins as well. Could it be that people are really, really stressed internally, and that's why we're seeing an increased number of problems, really, both physical and internal and mental, basically?
Absolutely. And I would put it in a slightly different context, and I think you'll see where this meshes nicely with what you just said, is that I started out by saying that all disease is excess oxidized biomolecules. Your primary antioxidant for bringing those biomolecules back to normal is vitamin C. And I will make the case that when you're able to normalize vitamin C levels inside a sick cell, you no longer have a sick cell, you have a normal cell. So basically, normalcy in a cell is defined by normal intracellular levels of vitamin C. Now, with that in mind, that then tells you the goal of all protocols of any type is to ultimately normalize vitamin C levels inside the affected cells. As it turns out, wonderful that you brought up cortisol. Cortisol and corticosteroids are not in and of themselves anti-inflammatory agents, although that's what they're called. They're only anti-inflammatory agents because, especially cortisol, the primary purpose of cortisol is to pull vitamin C inside the cell. So the role of cortisol is to bring the ultimate anti-inflammatory agent, vitamin C, inside the cell. And the reason that we have so many problems with side effects, and why, for example, you're talking about elevated levels of cortisol. Well, cortisol levels don't elevate until the extracellular levels of vitamin C are so low that the body keeps on trying to make more and more to put it inside the cell, but there's no vitamin C left to put inside the cell. So that's why these things always need to be administered together, combined with the fact that, unlike the wild animals, we should be making vitamin C inside our liver from glucose, okay? And so that when we get an acute stress in the blood, an emotional stress, I might add, as well as a more physically defined oxidative stress, two things happen. One is the adrenal glands secrete cortisol, and in an animal, the liver makes vitamin C. We lost the fourth enzyme. So we don't make the vitamin C, but the one thing we do is we accumulate glucose. This is the reason why we have so much diabetes. It's because we lost the ability to use up the glucose to naturally make vitamin C. So we get a double hit. We get less vitamin C and we get more glucose. So bottom line is, it's very important to realize this extremely interactive role between cortisol and vitamin C because, and I make this case as well, nearly everybody who's older, I'll leave that undefined, but if you're getting infections, colds, flu, you are adrenally insufficient, period. You don't get colds and flu if you're making enough cortisol, unless you're severely depleted in vitamin C. And then, of course, the natural treatment then is to take the two together. But all of this goes together quite naturally, and I can tell you everything that you see that has to do with cortisol, start thinking in terms of the fact of what the adrenal gland is doing in terms of trying to get vitamin C inside the cell. It's very interesting also, one other small point that adds to this is the adrenal glands themselves. They're very small. They're very small. But inside the adrenal gland, they have the highest concentration of vitamin C anywhere in the body. I would propose that this is an adaptive response because the first thing that happens when you get a stress in the blood is not to release cortisol, but to release all the vitamin C that you have stored inside the adrenal gland, which has evolved to try to adapt to the lack of the ability of the liver to make vitamin C. And it works very well when you have a short, small stress. But when you have a big, long, chronic stress, it's inconsequential.
So one thing that's, or do you have a question, Per?
I just imagine that listeners, one question will be at the top of many listeners' minds right now after hearing you say what you said. Very simply, how much vitamin C do you need daily? And yeah,
vastly more than we take. Using the example of the animals, all right. There are many animals out there that make vitamin C, only a few that don't. Guinea pigs don't make it, bats don't make it, but goats make it. And we use the goat as a good example because if you take a 150-pound goat, about 70 kilograms, that goat will make, if it's not stressed, 5, 6, 7, 8 grams a day and secrete it directly into the blood. So you're not looking at any problems with absorption. So you say unstressed, no problems. You should be taking 8 grams and pumping it straight into the blood. And when you're given a extremely high infectious or toxic stress in the body, the goat will start making 20, 30, 40, 50, 60 grams a day and secreting it directly into the blood.
wow.
So the point being is we're nowhere near close to the amount of vitamin C that we need. That brings us also back to why trying to combine vitamin C applications and therapies with cortisol, which is what I discussed, is so important too. I mean, you can overcome the need for cortisol by taking massive amounts of vitamin C, but most people don't have the facility, ability, or economy to do that. So you need to take and make sure that the doses of vitamin C that you do take can be adequately ushered into the cell by taking an appropriate amount of cortisol. And I want to quickly say this because doctors and the public are just so loco about steroid side effects, okay? What I'm talking about here is natural hormone replacement. I'm talking about addressing a cortisol deficiency that should be made by your adrenal glands. The same way I talk about a testosterone deficiency, an estrogen deficiency, a thyroid hormone deficiency. I'm not talking at all about ever giving prednisone, methylprednisolone, dexamethasone. Those are all
I think we lost him.
Yeah, he froze.
Ska notera det på något sätt.
The
You disappeared there for a second.
Oh, okay.
No, never mind. You were talking about you were listing. You made a list, and then you broke off.
So I'm saying, so the things that you need to do is you always want to get the vitamin C inside the cell, because absorption-wise, we have a very limited ability to absorb vitamin C because it's a limited number of receptors. And that's another reason why the internal synthesis is so profoundly important, because it bypasses that completely. Now, I don't know what the availability is in Sweden, but there is a company in England called Altrient, and they make a liposome encapsulated form of vitamin C.
No, we have those as well.
Okay, but it has. There's a lot of fraudulent liposomes out there. That's why I bring it up. This came from work that was done 20 years ago. But when you use a legitimately liposome encapsulated form of vitamin C orally, you bypass a lot of these problems because it's almost completely absorbed and even gets inside the cell better than when you give it intravenously.
Interesting. So I have two comments or things I've thought about when you spoke. So one thing that we have discovered throughout the years is that because a lot of people come to our clinics with some kind of pain, and they usually think that they come with a back pain, and then they think that the back pain was something that was created a day ago or a week ago or a month ago. But when we ask them about their lifestyle, their background, their history, what they've been up to, how they've been living, what has happened throughout their lives, we can clearly see that the start of this process that led to the back pain could be 2 years or 5 years or even 20 or 30 years old, because it's an accumulated problem. And then one day it just hits, and then you feel the enormous pain, but you've actually been living in a body that's reduced its functionality, mobility for a couple of years. But people don't tend to think in that way. And I think it could be the same, or I think it is the same about stress, because you don't really sense that you are under this pressure you're under until something happens. And about 6 months ago, 7 months ago, I tried IV vitamin C for the first time, and the first effect was surprising. I was very alert, but the second time I tried it, I was a lot happier, and I realized that I've been under a constant pressure for 5 to 6 years, because I remembered myself the way I was back in 2017 or 2018. And
what gram dosage? How much did you take?
15 grams
50.
with magnesium as well. So I think it was
Good.
1 gram magnesium and 15 grams vitamin C.
Okay.
But it was interesting because it's the experience of realizing that, oh, this is how you can feel, made me think about, and I'm quite a healthy person. I've been taking supplements of vitamin C for 5 years, and I'm doing what I can to stay healthy. But still, the shock of seeing what was and what could have, or how I felt and how I felt afterwards, it was really interesting. And then I thought about how many people are living with long-term chronic stress and chronic vitamin C deficiency. And then we looked at the functionality of vitamin C and realized that it's about the mental state, it's about the physical state, it's your adaptation to stress, it's your immune system. It's a lot of things that vitamin C helps the body's normal functionality of, as they say in the Food and Drug Administration.
Let me add one thing at this point in time that syncs with that. I make the assertion, and I stand by it, that because of what disease is, when you have low vitamin C, you have inflammation. When you have inflammation, you trigger the immune response. If you look at the cells of the immune response, the first one is the monocyte. The monocyte has 80-fold, 8,000% more vitamin C inside it than any other cell. I propose to you to make it really simple. The primary overriding purpose of the immune system everywhere in the body is to do one thing, and that's to optimize vitamin C levels inside the cells, especially where you have inflammation. Once you resolve inflammation, you've resolved the inflammation because you've got the vitamin C levels back up again. And you shut off the reason to stimulate the immune response. But I mean, nothing could be more complicated on the planet than an immunology textbook. I mean, the abbreviations and the pathways are limitless. I mean, they put my head in a spiral. But I'm going to tell you, and I don't mean it as an exaggeration, I consider the primary overriding role of the immune system is to normalize increased oxidative stress where it's found.
But it's an interesting perspective, because instead of looking at all the complex details, you look at the system as a whole and the functionality as a whole, and that pair is something we have came across a lot, like how much changes when you look at it as a whole, as an ecosystem, instead of as different parts.
Right. Yeah, of course. I have one question. It's extremely interesting to hear what you're saying regarding vitamin C. I also actually read your book on the subject a couple of years ago, but I find myself having forgotten too much of it.
You weren't taking enough vitamin C while you're reading it.
Yeah, well, I still take, I hope not too well. Okay, I will probably have to increase the dose after hearing you say what you said a minute ago. But now my question, it seems to me when listening to you describing all the functions and effects of vitamin C, that it appears to be a kind of, is it too exaggerated to say that it's a key molecular component in the actual, well, day-to-day working of the whole living body? So it's much more central or pivotal, or however you want.
No, it's the single most important molecule in the body. Absolutely.
Yeah, that's what I'm hearing. I just
Yes.
wanted you to confirm that.
Yeah, absolutely correct. And a lot of this too, you see a lot of supplement companies and everything, and they're promoting their products. This supplement does that. And you see this silly thing called an ORAC score, oxygen radical absorption capacity, that they use to rank the strength of antioxidants. All right. And I'm still not exactly sure how they do it. Something about how readily the electron is given up. Never been clear on that. But they come out with these statements that, for example, astaxanthin is 6,000 times more powerful than vitamin C. So wow, let's just stop taking vitamin C and let's start taking astaxanthin. Well, there's so many things that doesn't cover. Astaxanthin is fat soluble, it's not water soluble, only goes to certain areas, large molecule. But the bottom line is you have to ask this question. If I stop taking all vitamin C and I take it out of my diet, what happens? I die of scurvy. Mm-hmm. What happens if I don't take in one more molecule of astaxanthin? Nothing. Okay, you don't die of an astaxanthin deficiency, no matter how well you can misconstrue it as being a more powerful antioxidant than vitamin C. And there's a lot of reasons for that. Vitamin C uses glucose transporters. It has its own other specific transporters. It has an intermediate state that's one electron depleted. It's water soluble. It gets into all the cells of the body, and it has a deficiency syndrome. So, yes, it's the most important molecule of the body. I mean, there's some rivals. ATP is important, but you'll never make enough ATP until you have enough vitamin C.
Okay. That's really interesting.
And it's interesting also because scurvy, you talk about it being in some parts of the body, but you were the one who looked at scurvy around the heart, right?
Yes, well,
and then it can be local in different senses, and
exactly.
it can
We
lots
use
of
the term focal scurvy. All right.
Mhm.
If you've not been taking in any vitamin C at all, or inconsequential amounts of vitamin C. All the tissues in your body are depleted. Collagen levels are practically at nil. Blood vessels are very leaking and falling apart. Your immune system, remember, no longer has a lot of vitamin C in it. So even if you have an infection, the immune cells don't have any vitamin C in them to come and attack the infection, and you eventually die of a generalized scurvy. On the other hand, as I mentioned, with the heart's a good example. Oh, well, anywhere you have a focal infection. If you have a focal infection, you've got focal scurvy. But it doesn't mean you have scurvy. But if you have a focal infection in your heart or in the breast or somewhere else, it doesn't mean that you don't have more than enough vitamin C in other areas of the body. So you definitely have generalized scurvy and focal scurvy.
And it's interesting because what we have looked at a lot throughout the years, so we come from a treatment background, but we discovered the importance of looking at the body as a whole, and that's why we, as a side project, basically developed the Fasciaguide, which is more understanding research, making it into so that people know it. So we've done that while also doing treatments, which means that we can translate what we read about into practical application. And some things happened when we started recommending all our customers to increase their vitamin C dosage. So treatment became more efficient. But the other thing so we realized that if you have a back pain, or if you have a frozen shoulder, if you have a bad posture, if you have something physical, a physical problem of your body, the way to heal it is to restructure the collagen fibers. And you restructure the collagen fibers by increasing the flow. So the more flow you have in your body of the fluids, the more intense the restructuring is. But adding vitamin C is really interesting because adding vitamin C stimulates the collagen production. So if you add more vitamin C, you rebuild your body quicker.
And interconnections too.
And interconnections as well. So what's interesting was then we had a friend of ours who had a frozen shoulder, which we couldn't solve it. We usually have a good track record with just frozen shoulders when you can't lift your arm. But this person, we tried for 5 treatments and no effect. And then she came to the clinic for an IV vitamin C injection because we had that as an option. And then we looked at her like, should we combine this? And then we took the IV vitamin C and then did the treatment directly after. And 35 minutes later, she could move her arm for the first time in 5 months. So it's interesting talking about stimulating the body's healing capacity. And I think a problem that we have when we, because this sounds so simple, it sounds like, okay, we can just take vitamin C and some treatment and then we can solve a problem that's unsolvable. It sounds very simple, but I think a problem is that people don't understand charges and the electricity of the body, because it is a matter of because the more structured water you have, which is Pollack's research, that the water wants to structure itself so that it has a high negative charge, and that negative charge also self-cleans. So you self-clean your system, you remove unwanted particles and toxins if you have the easy water, the exclusion zone water. And the more easy water you have, the quicker the healing is, the better the memory is, the better the functionality of the body is. And if you look at vitamin C as a negative charge or negative supercharge in the body, which is overrun by these free radicals, then it actually makes a lot more sense. But I don't think people are used to looking at the body as an electric system.
Let me say this, and I write about this in particular too, is, as I'm sure we realize, current is electron flow. Okay, that's the definition of physics, electron flow. We have identified in cells microcurrents. We have identified in cells transmembrane voltages, where the more current you have flowing, the higher your transmembrane voltage. And we have studies that show when you get above a certain level, I think 50 microvolts, you have your healthiest cells. Well, going back to what I said about toxins and vitamin C, okay, vitamin C is the electron distributor. Nutrition is the electron that brings the new electrons into the body. Now, what happens is toxins are toxic not only because they oxidize, but because they permanently take the electrons out of circulation. Once a toxin has assimilated an electron, it becomes chemically stable, it's reduced, and it firmly holds onto that electron and never gives it up again. With the vitamin C in its reduced and oxidized form, you go back and forth, back and forth, back and forth, back and forth, back and forth. And higher amounts of vitamin C give you more of this distribution and generate these microcurrents. So basically, toxins are microcurrent blockers, and vitamin C are the microcurrent promoters, and other good antioxidants, but specifically and most importantly, vitamin C.
Which stops the flow, the microcurrency blockers.
Right, the toxins block the flow, right, because they take the electrons out of circulation. They steal the electrons, if you want to be more emotional about it.
Yeah. Which is interesting when you look at the principal parts of the living body. We talked about, we try to make the body as simple as possible to understand from a holistic point of view. So starting with the principle what life is, that all that lives has a flow. And flow, the more flow you have, the more alive you are. And then the microblockers will then, the microcurrent blockers, the toxins will then block life, which means that we are less alive the more toxins we have, which is an interesting way to put it, I would say.
I have a very much more general, almost philosophical, but indeed scientific question as well. My PhD is in human ecology, which means I have also some background in evolutionary theory. So I can't help but wonder what happened to humankind. How did we lose
the fourth
the
enzyme
ability to synthesize vitamin C? Have you do you know anything about that?
Well, I'll tell you 2 words, and you can decide whether you want to go further with the discussion or not.
Yeah, okay.
In my opinion, 2 words: extraterrestrial manipulation.
In what sense?
In what sense? This is the easiest way to keep another civilization in check and chronically ill by taking away their ability to make the most important molecule in their body. And incidentally, when babies are born, they can still make vitamin C. We gradually lose the ability. I don't know which toxin it is, but somewhere along the line, that toxin comes along and causes an epigenetic defect so that we can no longer transcribe the 4th enzyme in the liver coming from glucose, which is called L-galonolactone oxidase. But, some people just don't have a second thought about other ETs. Some people are very strongly into it, but I don't see this accidentally happen. And the other thing too, and this is why it probably even more than the vitamin C deficiency is keeping the population sicker and easier to manipulate, if you will, is the astronomical increase in diabetes. Remember, that's what I said is the normal role in your body for glucose is to be converted into vitamin C, not to accumulate in large amounts and need injections of insulin pushed inside the cell. As it turns out, in my opinion, if the liver was functioning normally, there'd be virtually no glucose left for insulin to work on. And then we would realize that the primary role of insulin in the body is to push vitamin C inside the cell, which it does in a competitive fashion with glucose. And to take that a step further, in my opinion, the whole reason for the Krebs cycle would cease to exist. The Krebs cycle has evolved, in my opinion, to deal with taking glucose and breaking it down so that the electrons can enter the electron transport chain and ultimately make ATP. But that could be completely bypassed if really the only thing that was going on was we didn't need to worry about the glucose at all, and the insulin was there primarily and only to bring the vitamin C inside the cell.
Interesting. When do we know when we stopped producing that enzyme?
Well, they say, I don't know how you come up with these figures, but they say, millions of years. I don't know how you would say that, but let's put it this way. I don't think there's any time in recorded history that we know of a time where we were making vitamin C. Okay. Now let me add one other thing too. It's not 100%. There are some people out there that make it. All right. So small percentage.
Have you? Can you
some
see?
make it.
Like, have you studied those people that can make it?
Yeah. Myself and Dr. Honeyhack, with the help of a drug called, not a drug, a nutrient called hydroxytyrosol. Hydroxytyrosol is inside olive leaf extract. And they had a study in 2017 with volunteers that showed when the volunteers took 50 milligrams of hydroxytyrosol a day, within 2 weeks, their serum levels of vitamin C had doubled. Now, to me, there was only one conclusion. That was you got over the genetic defect and you started making it. But we decided to do our own little test. It's we published the results. I mean, not on the Orthomolecular Medicine News Service, but I went to Dr. Honeyhack. He works at the Ribbon Clinic. He's very prominent in vitamin C therapy. So we decided that we needed to check this by giving the body a large oxidative stress. So remember we talked about oxidative stress means make more cortisol, and if your liver is working, make more vitamin C. All right. So we said, well, we need to pick a toxin. So we picked alcohol. And I settled on scotch, and he settled on dark beer. And he had some people from the clinic there to draw blood, and we weren't driving or going anywhere else. So we both got pretty blitzed, got our before and after vitamin C levels drawn, and then went to bed, drawn again the next day. Now, results. If you're taking a large amount of a toxin and you're not making new vitamin C, what's going to happen to the level of vitamin C in your blood? It's going to drop. Okay, you're using it up. On the other hand, obviously, if a large toxin is causing the liver to kick in, you're going to raise. Well, we both raised our levels astronomically of vitamin C. They stayed elevated for 24 hours, and then they gradually came down the next day. So it's not 100% in everybody. I might add, and no inclination to be in any way political here, but just to make an observation, forget the politics. President Trump makes his own vitamin C. I have never seen a 48-year-old person, much less a 78-year-old person, go as fast as he goes, as hard as he goes. The man sleeps about 4 hours a night, and he never slows down. I have no doubt in my mind if we were to check vitamin C levels on him. And he also doesn't pay attention to his diet either. you know all the stories about McDonald's and everything like that. So, but anyway, these people do exist. This is why you have occasional 95-year-old guys who have had their scotch every day and their cigar every day, and they're doing fine. And then you have other people that drop dead when they're 50.
But do you think if it's an epigenetic defect, do you think you can reactivate the gene?
Yes, a hydroxytyrosol reactivates. But we don't have extensive research. This is waiting to be done. All right.
So what you could do is you could actually have an experiment trying to reactivate that gene.
Absolutely. This
so
could
that's
be a project.
that's
You had asked about projects. This would be a good one because I don't have a patient population, and so I don't have an office in that regard. I have ideas. But we already showed in our, I guess you could call it pilot study, that it's very dramatic. So really the only, and we also showed probably on 15 or so other people that the hydroxytyrosol increased the vitamin C level. So what really remains to be determined is it a full restitution? Does it only last for a while and then burn out? I mean, we don't know any of those questions. We don't know if we'll take you 50 milligrams of hydroxytyrosol a day for the rest of your life, bring you back to normal levels of vitamin C when you need it? We don't know. Those are the things that need to be answered.
So that is really interesting. So we have in one,
and we had another simple study too.
Yeah.
We're thinking of doing this because it's really easy, but we haven't done it yet. Which is the long-term glucose glycation levels that they measure. Okay, so what would be interesting is to take the little patch, wear the patch, okay, that monitors your glucose levels, and then start taking the hydroxytyrosol, okay, and then two things: see if your average glucose drops, number one, but even more importantly, see if 3 months down the road you've significantly lowered your A16. I'm blanking out on what the glucose test is, where you look for your long-term effects that they're always looking for with diabetic drugs to try to drop that level. But if that would be the thing to do, and it takes a long time, it takes about 3 months of glucose control before you start to see the changes. But that would be really easy to do. I mean, you could get 50 people really quick and put these little patches on their arms and read the monitor. I assume you can interrogate the devices so that you see what the levels are, and then just to do before and after long-term glucose accumulation tests.
Interesting.
Indeed.
Is there any like side effects to hydroxytyrosol?
No.
So I could basically try it myself and see if it works.
And it's easiest. They have the highest levels we found in olive leaf extract. Okay, so if you want, I can send you a link to a product that you can get where one capsule gives you like about 60 or 70 milligrams of hydroxytyrosol as part of the olive leaf extract, and you can check on that for yourself.
And how much did you take to stimulate the enzyme?
Well, in the test where they in 2017 they were with 14 volunteers, it was just 50 milligrams. Is all they took a day to double their vitamin C levels.
Okay, interesting. Huh. It's okay. So I'm fascinated because we both have vitamin C as an as you call it, the natural pancreas, like a natural way to help the body deal with a lot of things. But then you also have the possibility to reactivate the enzyme that we don't have activated anymore. And if we did this, we will be better to handle stress. We will have a better capacity of curing our own diseases and stimulating the body's natural healing capacities. And for those who hear this and think that this is too good to be true, I haven't done this before, or if you have that kind of feeling when listening to this, what would you say to them?
Well, I don't know, when people say something is too good to be true, I would say, well, first of all, a lot of times something is too good to be true, so you're right there. But the rest of the time is you have no idea. So I mean, if you just want to be a naysayer without putting any thought into it, you shoot down any argument that there is. But anybody who thinks it's too good to be true, the first thing I would say is, well, point by point, tell me why everything I said was wrong.
Yeah.
Yeah. Do you have any final questions, Per?
I certainly have. So I'm looking forward to meeting you soon, and I think we have enough for the purpose. Our purpose
Of this conversation.
Yes.
I'm excited to see what happens when people hear about this on a large scale and we really publish it. on a large scale. And it will be interesting to see what happens if those people who have invested all these funds into making people healthy or helping people get healthy, and they hear about this.
I can tell you this quite humbly. This is just but a small slice of the ideas I have that could be researched and tested if there was the financial back.
And what would happen if this was financed, do you think?
Oh, well, it depends on the project. I mean, you advertise a product as being able to synthesize vitamin C, but there's a lot of other things too. Demonstrate that the product decreases objectively the long-term damages of diabetes, which if you knock down, I keep on forgetting the name of the. You measure glucose, and then you also measure the long-term parameter, G6116. I don't know what it is, but when you get that number down, that's what they say. When you really have your diabetes controlled and your insulin is really doing everything you want, then you fall below this level, and you have the documentation that you're at least minimizing long-term damage. I say minimizing because we don't really know what our optimally low level of glucose should be in our body for all the reasons that I've already talked about.
Well, it sure is interesting. Should we end it there? Yeah. Thank you so much for the conversation.
To be continued, we could say.
To be continued.